Welcome back. Rolling blackouts impact negatively across all facets of daily life and on business operations, but it can become a matter of life and death in hospitals and clinics. It's with this in mind that the Health Department announced in a briefing this morning that it's working on a plan to get all hospitals in the country protected from power cuts. As it stands now, only around 10% are shielded from blackouts. Let's find out more about the plan from Health Minister Dr. Joe Phaahla. Thank you very much, Minister Phaahla, for your time this evening. So we know you held that press briefing this morning. For those of our viewers who might have missed it, if you could just tell us what the plan entails to get all hospitals in the country shielded from blackouts to protect patients, especially patients in ICU and babies in incubators. We know they are the most vulnerable.
Well, the plan is quite a straightforward one. Our first priority is to get as many hospitals as possible to get direct line, of electricity supply, separate from any other localities in which they are located, so that there is a direct line through which they can be protected, they can be exempted from the load shedding in the locality in which they are located. So that's really the drive of what we're pushing as urgently as possible. A few have already happened. Now, in terms of that, we have been informed by ESCOM that there are two categories. There are the hospitals and other health facilities where the area in which they are supplied directly by ESCOM. They will work with us to find ways, even in those cases directly with ESCOM. There are other areas where the municipalities, metros, districts are the ones who buy the electricity from ESCOM, and then our facilities and all the areas in which they are located are supplied by those local authorities, in which case they need to work, they will help us to work with those authorities to try and get a direct line to those facilities. That's our first priority. And then, of course, over and above that, we're looking at, in the meantime, where those which may not be assisted, beef up their diesel supply to keep them running with their generators. But lastly, long term, we will also want to add, to add additional independent power supply, green energy, solar energy, batteries, and such technology to beef up our security.
Certainly, a mixed energy approach is the modern, more technologically savvy way to go, rather than relying purely on one energy source. But that does come at quite a hefty price tag. So is there budget allocated? Has Treasury come on board to say we're going to support the Health Department in this drive? Or who ultimately is going to foot that bill?
Well, even before we go there, we have been informed by ESCOM that there are facilities where it will be quite, straightforward to do the direct line, but there are some of those facilities where there will be some costs in terms of installing separate cables to divert from the normal area, from the other consumers in those areas. And they've told us that there are areas where there's going to be additional costs. So at this stage, we're setting up teams there's a standing team led by our DG and the ESCOM head of generation to work on a weekly basis, starting from next week, with all the facilities submitting their requirements. But over and above that, many of our provinces and facilities have run out of their budgets for diesel because they didn't cater for stage 6 and stage 5 of prolonged, using the generators. So we are talking to Treasury in that, but also long term, we have to, together with Treasury, look at our infrastructure plan for the next financial year starting now, look at the additional. So there are those cost implications. We've already put up the word to our colleagues in Treasury that we need to discuss these matters.
Looking at the long term, the overview, the big picture of load shedding in South Africa, it's only really hitting home to South Africans now that we've had load shedding for 14 years. Throughout the 14 years that have just gone past, have there been calls from the health department for hospitals to be put on direct lines or exempted from load shedding? Or has there been sort of an expectation that load shedding is not going to be with us for very long, so that's not necessary? And if that's the case, not to make the question too complicated, but one has to read between the lines and say, if the health department is now asking for hospitals to be put on direct lines, does that mean that Cabinet is fearful that not only is load shedding going to be with us until 2025, as many of us have come to expect, but much further into the future than that?
Well, the alarm bells have been, ringing, but, as part of government, there's been a lot of discussions about, interventions. We've been listening to the CEO of ESCOM, the COO, board members talking about, maintenance plan, and that, it will get better. I think if you remember, even last year, there was an expectation that now, with the maintenance plan, there's going to be, downward, sort of a need for load shedding. So I must admit that maybe we were rather too optimistic in terms of listening to some of the briefings suggesting that the plan is working. But in the last almost like 2 months, when after you would remember that somewhere after the president's announcement in June, there was almost like 6 to 8 weeks of totally no load shedding. And then it started a little bit and then hit very hard at stage 5, stage 6. I must admit that that was a wake-up call to say this is a much more deeper problem and it's going to take much longer time to get it done. And when you have prolonged periods of alternating stage 5, stage 6, stage 4, and losing, the grid power for on average 8 hours or even more in a day, it's very hard on our systems in terms of our backups. So that really, I must say, hit home to the fact that if after all the interventions and the maintenance which were promised, but you still go back to stage 5, stage 6, stage 4 on average, then it's going to be a marathon. So that's why we, also, of course, with a lot of, appeals from health professionals and other stakeholders to say, this is not going to be a short term. And that's why we then said, look, we must accept the fact that it looks that way, and we must have preparations for the long haul.
Excellent. Thank you very much for speaking to us. We look forward to those plans being put into implementation so that at least patients in hospitals can rest easy knowing that they're not going to be put in danger. Thank you very much. Health Minister Joe Phaahla, Dr. Joe Phaahla speaking to us.